Turmeric is a spice that comes from the turmeric plant. It is loaded with healthy nutrients and it can provide many health benefits. Turmeric's most powerful and active ingredient, curcumin, is a natural compound with anti-inflammatory antioxidant properties. The recent studies suggest that though using it in a limited amount is safe for health, but excessive use of turmeric can lead to many problems as well. It is often recommended to be taken in its natural form rather than taking its supplements or capsules. Here are some of the noteworthy turmeric side effects that cannot be ignored. Number 1. Upset stomach. It is said that eating turmeric can heat your body and may result in inflammation in your stomach, leading to abdominal pain and cramps. So, ensure you take turmeric only within the recommended dosage. Number 2. Cause an allergic reaction. Some people are allergic to some of the compounds present in turmeric that may result in outbreaks, rashes, and even shortness of breath. Both ingestion and skin contact can result in the allergic reactions. Number 3. Cause nausea and diarrhea. The active compound found in turmeric, curcumin, can hinder the normal functioning of the gastrointestinal tract, resulting in nausea and diarrhea. Take turmeric within limit. If you observe any symptoms, stop the intake and consult your doctor immediately. Number 4. Increased risk of bleeding. Taking turmeric has been found to slow blood clotting. This can eventually increase the risk of bruising and bleeding in people who are suffering from bleeding disorders. Turmeric might also interact with certain medications and cause excessive bleeding. Stop taking turmeric if you are suffering from any bleeding disorders or are on any medication for the same. Number 5. Lower blood pressure. Well, this could sound like a benefit, but lowering blood pressure way too much can cause complications. High doses of turmeric can lower blood pressure, and hence, individuals on blood pressure medications must exercise caution while consuming turmeric.